We have more now on that breaking news out of Manitoba. The province is reporting 480 new cases of COVID-19 today. Manitoba's Chief Medical Officer of Health announced new measures today. They include moving the Winnipeg metropolitan region into level red, the highest level on the province's pandemic response system.
These restrictions are essential for us to get on top of the cases that we've been seeing in our region. They'll be legally enforced 12:01 on Monday, but that doesn't stop any of us from implementing them immediately. We see the numbers, we've seen the climb in transmission, especially in the Winnipeg region. We need to get on top of this now.
The CBC's Cameron McIntosh is in Winnipeg, where new restrictions are about to be enforced. So Cam, let's just talk about how life is going to change there, and just to listen to some of what Dr. Brent Roussin and Lynette Siragusa had to say. I mean, this is really big news in Manitoba. It's big news in the country, frankly.
Well, yeah, so let's put this into context, Andrew, especially for people that might be watching right now in Winnipeg or in the Winnipeg metro region. This isn't quite the lockdown that we saw back in March and April, but it's not far off of it. So non-essential businesses will be allowed to continue operating at 25% capacity. And school for now is not shutting down. There's no changes to school, but here's what will be changing. We have some boards here. Bars and restaurants will be closed except for takeout and delivery. Most retail, as I mentioned, is down to 25% capacity, and sports and recreation programs will be suspended. So if you have a child in, say, minor hockey or ringette or something like that, that is suspended for now. Gyms and fitness centers will be reduced to 25% capacity with mandatory masks. Movie theaters, concert halls are closed, and faith-based gatherings are reduced to 15% or 100 people. I can tell you right now, Andrew, we're getting some blowback on social media on that one. There have been some spreading events that have been linked to some church services in southern Manitoba. Still, the province says that it's looking to find a balance here, looking to find a balance between dealing with the virus, which clearly right now in Manitoba is moving through the population quickly, and not completely shutting everything down, having an economy to come back to. And it's been a real tricky line here for Manitoba. In fact, earlier this week, Brian Pallister, the Premier, came out and basically lambasted people for not abiding by the COVID regulations, saying, listen, the government can't prevent you from getting this disease. And we have not yet heard from the Premier today. We don't know if we're going to, but definitely a lot of people are absorbing this right now and trying to figure out what this means for themselves and their lives going forward, at least for the next 2 weeks, when these red restrictions in the Winnipeg area will be reviewed. Meanwhile, the rest of the province moves into orange restrictions.
Yeah, that is interesting. That you wouldn't hear from the Premier today. I know that we're going to hear from the Mayor of Winnipeg in about 20 minutes from now. Just to put this into perspective, the reason why we're focusing on this is that, I said it before, it's the highest per capita number of new cases reported in a single day of any province in the country since the pandemic began. I mean, that's just the facts. So, and we'll get into that a little bit later. Yeah, go ahead, Cam.
And those numbers are a little hard to really pin down. And I asked Dr. Brent Roussin about this because there is a backlog in reporting here. There's been backlogs in testing, backlogs in contact tracing. They haven't been able to fully follow through every case to see if people are recovered. It's getting harder and harder to figure out where the transmission is. So that active caseload, I asked, can you say with confidence how many people in Manitoba, how many people in Winnipeg have COVID right now? And the answer back was, well, we can tell you how many people we've tested. So figuring out that number precisely and just how fast and how rapidly this is spreading right now, they really can't nail it down at this point, but it is concerning. The spread here does appear to be going faster than it is in any other part of the country right now. And quite frankly, the Chief Medical Health Officer, Dr. Brent Roussin, is basically telling Manitobans that we have to get this locked down. We have to get it taken care of now, or it's going to get even worse.
Because 309 reported in the city of Winnipeg. Cam, and I can see the snow on the ground behind you. That is not unusual for this for late October in Winnipeg. I remember that's the way it goes. And the colder weather brings more and more people in inside, so that's concerning. Now, the rising cases did prompt doctors, Cam, to call for a province-wide shutdown. What can you tell us about that? And do these new measures come close to what they've been asking for?
They come close, but they're not. It's not a province-wide shutdown.
Yeah.
Things will remain open. But let's put this in perspective too. ICU capacity right now in Winnipeg is at 96%, and that's what's really putting a lot of urgency on this. Today, the province outlined plans
let's
to
think about that, Cam. 68 out of the 71 ICU beds in Winnipeg are full right now. 19 are COVID. We should say it's not all COVID, but the point is, 96%. That's a serious number.
Well, and that's a good point, Andrew. It's not about COVID. It's about access to those beds.
Yeah.
If you have a heart attack, you may have a hard time getting into an ICU bed if you need one in Winnipeg right now. That's what is potentially playing out here, and that's what this is really all about. So today, the province outlined plans to potentially move people that are of low acuity in a hospital into non-hospital settings. They are making those plans right now. In fact, the plans, they say, were made in the spring. They never had to be activated or executed because we never really did have a problem. Keep in mind, and this is what's really stunning for people here in Manitoba, back in the summer, we were talking about flat Manitoba, no COVID here. We went 13 days without a single new case. The province was very eager to get the economy back going. There's a Restart Manitoba campaign going on right now and still going on. In fact, if you look at the COVID stats online on the provincial website, the banner says Restart Manitoba. So, there's a real kind of mixed message there that people are really grappling with here. And I can tell you, while I was in that press conference, my phone was lighting up, family and friends, not just work, sending questions that they wanted answered. So, this is really stunned the province right now, and it's really throwing people for a loop with a lot of concern. And of course, it all comes down to that capacity of the medical system. Now, they are telling people not to panic. If you need to go to the hospital, go to the hospital if you are having a problem, but the warning here is quite stark. At 96% capacity, the ICU is a problem right now, and that's what we're hearing from doctors. That's that letter that came out from several doctors today in Manitoba calling for a even tighter restriction.
Yeah, you heard them say, on the one hand, this is the challenge of our lifetime. On the other hand, this is not the time to panic. The numbers seem daunting, but we know what we can do. We know what needs to be done, and we can do it. But Cam, can you tell me more about what you're hearing from people? Are people stressed?
Well, people are stressed out. Just my life, I deal with a lot of people that have children in school, and people are wondering, can kids go to school on Monday? Yes, here in Manitoba, the school rules aren't changing. What's in effect today will be in effect on Monday. Basically, the province is saying it's happy with what it's seeing in schools right now. It appears transmission in schools is low, so it's going to continue on. So that's going to be a relief for a lot of people, but a lot of people right now are wondering, do I go back to work on Monday if they're back working in an office? Potentially wondering if they're working in the hospitality industry, if their restaurant is now shut down and only going to delivery. Does that mean more layoffs? So a lot of livelihoods on the line here. A lot of people wondering just how their life is going to play out over the course of the next couple of weeks. And the parameter put on this is we'll review this after a couple of weeks. So if the numbers don't start dropping, if we're still here in a couple of weeks' time, then what? What does November look like? What does December look like? A lot of people, it snowed here this week, as you mentioned. You can see the snow on the ground behind me. The sky's been gray for a few days here. A lot of people are starting to look down the barrel of a very long, perhaps dark and hard winter, particularly if you're cooped up in the house. Maybe you have kids that have just lost their extracurricular activity, that sort of thing. So a lot of people are really getting anxious about what this could mean in the coming weeks and perhaps months, not to mention Christmas.
Yeah. We're just, try and just chug along, and if you can't, reach out, talk to your friends, talk to your family, talk to professionals if you need to. There is the help out there. But Cam, appreciate you taking the time today. That is the CBC's Cameron McIntosh in Winnipeg. So with more on how Manitoba's cases compare across Canada, let's bring in the CBC's Megan Batchelor. So Megan, Manitoba is way out in front of the rest of the country at this point. Can you kind of put that in perspective for us?
Yeah, Andrew, it kind of felt like it came out of nowhere because relatively speaking, in the case numbers, talking about Manitoba, it felt so much smaller than the numbers that we were seeing out of Quebec and Ontario. But of course, we know the better picture painted here is how it reflects in the per capita, because the population overall in Manitoba is also so much smaller than Quebec and Ontario. So let's break this down by per capita. So 480 cases announced today. That breaks down to 348 cases per million in Manitoba. By comparison, in Ontario today, that per capita rate is 60 cases per million, and BC's numbers yesterday was 45 per million. So 348 is astronomical. That is by far leading the country in terms of cases of COVID-19 per capita. And it's also surprising because Manitoba really had such a handle on this in the first wave. The most cases during that time was around the dozen or so mark, if I remember correctly, and they really appeared to have a handle on it during those first couple of months. And basically since September, those cases have been creeping higher and higher with this just insane number today, 480 new cases. The test positivity rate in Manitoba is now at 8.6%. That too is a record. The number of tests that were completed as of yesterday, 2,800 or so. And the 7-day moving average today for Manitoba is 206. Again, that is another number that is far above the rest of the country. And according to these numbers, Manitoba passed Quebec in terms of the worst epidemic in the country 4 days ago. And of course, with these numbers, Andrew, it only continues to surpass that.
Yeah, and Winnipeg is approaching a test positivity of almost 10%. So Winnipeg really hard hit. We heard Cam talk about hospitalizations. We heard him talk about the ICU. We've seen that number over the last hour or so, 96% of ICU beds full in Winnipeg. You've dug up a bit more detail for us on that. What can you tell us?
Yeah, so 96% of ICU capacity in Winnipeg is being used. 68 out of 71 beds are in use as of this morning, 19 of those being occupied by COVID-19 patients. And this is a concern because the province looks at the case numbers as a bit of foreshadowing for the hospitalization numbers. And that is certainly a concern, seeing these astronomical numbers and what that might mean in the next week or so when some of those people might be requiring hospitalization. And here's what officials are saying when it comes to preparing for that wave to come into the hospitals.
And these numbers are concerning. And with these daily case counts increasing, we can expect there's going to be more hospitalizations in the next week or two. And that is why we will be moving towards ramping down services along with the red restrictions. So beginning on Monday, surgery and endoscopy will begin suspending non-urgent procedures.
And this comes on a day, Andrew, where 12 Manitoba doctors penned a letter, an open letter that was published in the Winnipeg Free Press, calling for a complete shutdown of Manitoba. So it will be interesting to see if the measures announced today go far enough as far as they're concerned in relieving the stress that is sure to come in a more serious way to the hospital system in Manitoba, Andrew.
All right, Megan, thank you.